Today we'll be discussing sympathetic receptors. This is an important part of ANS pharmacology, the autonomic nervous system pharmacology. We have to learn pharmacology based on its receptors. So today we'll discuss sympathetic receptors. Basically, if you look at it, sympathetic receptors, like the sympathetic system, are related to the fight or flight situation. A fight or flight situation. It's activated in emergency conditions, in emergency situations. So there are two types of receptors here, alpha receptors and beta receptors. If we further divide the alpha receptors, we have alpha 1 and alpha 2, and if we look at the beta receptors, we have beta 1, beta 2, and beta 3. We'll also discuss their locations. Another thing you need to remember is the vasomotor function of alpha versus beta. Think A, B, C, D. This means alpha constricts and beta dilates. You have to remember this, A, B, C, D. Then you can group them like this, AC meaning alpha constricts and BD meaning beta dilates. Now let's look at the locations of the alpha receptors, the locations. Regarding the locations, you should relate alpha 1, you need to remember that alpha 1 is related to vessels. Okay, it's related to vessels, and you must always remember that it's related to vessels and it constricts them, meaning it causes vasoconstriction. For example, if this is a vessel, it will constrict it, and when the vessel constricts, it will increase the blood pressure. Okay, and its nature is excitatory. Alpha 1 has an excitatory nature. What about alpha 2? Alpha 2 is inhibitory in nature. It's found in the pancreas. So what does it do in the pancreas? It decreases insulin, and it's on the presynaptic terminals, so it decreases neurotransmitters. It's also in the salivary glands. So in the salivary glands, it decreases the secretion of saliva. Now let's talk about the beta receptor. Beta 1 and beta 2 are the main ones. So remember beta 1 this way. Humans, we have one heart. Since we have one heart, beta 1 is in the heart. Beta 1 is related to one heart. Beta 2 is related to two lungs. We have two lungs, so what's in the lungs? Beta 2. Remember it that way. So all the beta receptors, beta 1, 2, and 3, are all excitatory in nature. This means that whenever they are activated, they increase the function. In addition to this, beta 1 is found in the heart and in the kidney. The main thing to remember for beta 2 is that it's in the bronchioles. And we learned the mnemonic ABCD. A constricts, B dilates, and since beta 2 is in the bronchioles, it dilates the bronchioles. So we can use this in asthma. Besides that, it's also in the heart, where it increases the heart rate. It dilates arterial smooth muscle. In the liver, it causes glycogenolysis, and in the pancreas, it stimulates insulin.